Hello, my name is Robert Bastris, and I'm a licensed acupuncturist in the state of Pennsylvania. I have been practicing for 20 years, and I wanted to share some information today about cancer and the use of traditional Chinese medicine as an adjunct treatment to Western medicine. According to the CDC, there are approximately 15 million Americans who are suffering with cancer and are undergoing cancer treatments. And I believe that traditional Chinese medicine is greatly underutilized in the treatment of patients with cancer. And I wanted to share some studies and some personal experience. So there was a study by Wang and Liu, and they followed over 1,000 children and adults who had leukemia over a 10-year period. And this was in Taiwan, and their study showed that acupuncture not only helped with the alleviation of the side effects of chemotherapy, it increased the patient's lifestyle, but at the end of the 10-year period, there was also a high correlation between people who used acupuncture and longevity. So people who frequently received traditional Chinese medicine acupuncture treatments had a 10% increase in the longevity of in their care. So that for me was a really important statistic to share. There's also some really interesting research on astragalus and ligustum, and these herbs are traditionally used for supporting the patients with leukemia. And what they found was that although they thought that using astragalus would be a problem because people already have too many white blood cells, they had too many unhealthy white blood cells, and astragalus actually helped increase the number of healthy white blood cells and decrease the number of, or had no effect on the cancer cells. So that was an interesting study. And then there's a scientist, Omura, and he is using his own stomach 36, which is apparently zero point 0.6 centimeters lower than traditional stomach 36. But using that with electrical stim has found that it not only decreases the telomere length of cancer cells, which are too long, but the normal cell, which can have telomeres that are slightly too short, it lengthens them. So it basically brings both sets of telomeres back to balance. It also helps with the healthy triglyceride levels in the blood. So a lot of excellent side effects from using stomach 36. When I work with cancer patients, I generally use a combination of scalp points, large intestine 4, stomach 36, spleen 6, gallbladder 40, and liver 3. I'm doing that to stimulate the stomach 36 point, which is used by Omura in that study, but also helping the liver to detoxify. And I have found that using a combination of the 5 points on the scalp for the liver, a point here on the side, both sides, just above the apex of the ear, one in the top of the head, and two in the back of the head that would mirror the area for the eyes. These points have been extremely helpful for patients of mine who are undergoing chemotherapy with the nausea, and just very helpful for all the liver symptoms of headache, constipation, nausea, vomiting, all of that. I try to see people once or twice a week, and it's especially effective just after or during their chemotherapy sessions. So these are some things that have been very helpful for me. I hope that's been useful for you, and I thank you so much for your time. Have a good day.